Hello, Dr. James Bogash, expert in health and longevity, and today we're going to talk about a topic that I brought up, well, we can say years ago now, and that was in the middle of the pandemic, everybody was saying, oh, we know everything, and we really didn't. Emotions drove decisions, they drove a lot of bad decisions, a lot of arguments, a lot of everything, but what I've said that over time we will start seeing some of the truth coming out about what risk factors were, the likelihood that the risk factors like prediabetes, poor metabolic health, what we knew back then, we still know, like that hasn't changed. As far as the benefits of things like the antivirals and vaccination, like we're starting to see that maybe that wasn't quite as sugar-coated as it was on the front end. But before I go on, make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel. So, this has to do with venous thromboembolism, so basically blood clots. And we know that being infected with COVID increases your risk of clotting. We also know, unfortunately, that being infected or getting vaccinated increases your risk of clotting. To say that that doesn't happen is false, no more than would say that it's true that people get clots with getting COVID. Those are both true, they're both well accepted. But what happens if those two happen to coincide? And that's what this study was looking at. And it looked at over 422,000 people over the course of a year, so October in 2020, so in the thick of things, all the way up to September 21. So we had a lot of people who were in the Delta variant, maybe the original variant, certainly not with Omicron and what we're dealing with these days. So what they looked at were 4 different groups. They looked at people who got vaccinated, and then they got infected with COVID within 90 days. They had people with no vaccination that got infected with COVID within 90 days of the study. They had people who got vaccinated without getting COVID. And then they had people with no vaccine, no COVID. So like that's the shiny example, right? Is the people that stayed healthy, nothing actually happened. And so what did they find? Exactly as we expected, those people who had vaccination were 231% more likely to get a blood clot. Like that's definitely higher. It's not zero. Those who had COVID were 666% higher. So definitely higher, almost 3 times the risk of having a blood clot with the vaccination. Now keep in mind these are relative risk numbers, so it's not like massive amount of people were getting blood clots, but it definitely increased your risk. And if you had poor metabolic health, you are already prone to blood clots, so I'm going to say just improve your metabolic health. That would be the answer to everything. Certainly sound like a broken record. But what would happen if you got vaccinated and then caught COVID within 90 days? Your risk of having a blood clot went up 2,971%. Holy fecal matter. That is just a catastrophic combination of events that massively increased your risk. So again, some of that depends on which vaccine we got, but clearly there was a concern. And to say that we knew everything in the middle of everything, there is no way that we knew everything. We weren't even close, and some of this data is still going to take years to sift through. So just throwing that out for education's sake. As always, I will post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.